Yeah, thank you very much, Surjit, and thank you very much to everybody at Advent Informatics for arranging this meeting and for the opportunity to present. I just want to take this moment to thank you very much for all the hard work you guys are doing to support ICM there in India, and I've been extremely impressed how quickly your team has picked up the software, and your scientists have given us very useful feedback over the last few years. So thank you very much for that. Maybe one day we'll visit India. I hope so. I've got to turn off the camera just to save the bandwidth here, just in case. Yeah, so the title of my talk is Driving Innovation in Computational Drug Discovery, Novel High Accuracy 3D Screening Technology for Targeted and Ultra-Large Libraries. So really focusing on the structure-based and the 3D ligand-based screening in my talk. I'd just like to start off by acknowledging the many years of research by Ruben and Max Totroff and Eugene Rausch at Molsoft, and talented scientists such as Paulo Lam and Arman here at Molsoft. All this work I'm reporting is their work. If you're not familiar with Molsoft, Molsoft was founded in 1994, and there were publications in Nature Structured Biology from the results of a very important protein-protein docking competition at that time, and ICM performed extremely well, which gave early adopters such as Bristol Myers Squibb and Merck and GNF great confidence in using the software. And since that time, we've competed in challenges such as the GPCR modeling and docking challenge, the Capri protein-protein challenge, and as Ruben described, the most recent industry-wide blind competition, Molsoft outperformed all other methods for redocking a ligand, RMSD, scoring and ranking ligands in a virtual screening scenario, as well as predicting of binding energy. And over the years, we've collaborated with Novartis. The 3D ligand editor is one of the things that we developed for Novartis with great help from the medicinal chemists. So if you haven't played with it yet, we can provide a trial license for that. But basically, if you read in a co-crystal structure, you can make modifications in 3D or in 2D, and then see the effects of those modifications on the predicted binding. It's designed for a chemist, but there's also under the hood a large number of CAD tools, so you can do substituent screening, you can search, you can do find linkers, and core replacement, and that kind of thing. So more recently, we've been working on new AI and neural network methods, particularly in the application for screening as well as modeling with fog. We've also worked with companies like Arrakis and other RNA-based companies for RNA drug discovery, Pfizer for protein modeling, and other companies for virtual screening and modeling. These four images just sort of summarize the key aspects. So if you're wondering what ICM means, it stands for internal coordinates. Mechanics, we don't use Cartesian coordinates, we use internal coordinates. One of the powerhouses part of the software is the bias probability Monte Carlo method, which was published by Ruben and Max in 1994 and has been integrated into other software that's on the market at the moment. So these, and also things like atomic property fields we'll cover as well, which is a ligand-based approach. So we have these for docking, structure-based docking, and ligand-based docking. Full suite of cheminformatics tools, homology modeling, bioinformatics. And we won't have time to cover those today. So, as I mentioned, we're going to focus on virtual screening. So, you get our customers report and our contract research projects show, and the publications show that you get extremely good hit rates using ICM for virtual screening. One of the reasons for that is because we provide a number of different approaches, and the method is continually being improved. So you can take your chemical libraries, it could be Synthon based, combinatorial based, or you could just go to a chemical vendor like ChemDiv and download a selection of their off-the-shelf chemicals that you could screen. So we have, in Molsoft chemical space, we have databases from thousands to hundreds of thousands to millions and trillions and billions of structures. Then you need to make a decision of how you want to screen. Do you have a high-resolution crystal structure? Do you have multiple high-resolution crystal structures? If so, you can use multiple structures to represent the flexibility of the pocket. Are you looking for a covalent binder? We have the tools there to do that, and most in Advent Informatics will be talking about that later today. And then we have a number of different software that you can choose to use, CPU-based or GPU-based. Once you've performed the screen, you get scoring. We have a physics-based score that has been continuously improved over the years. A relatively new scoring method called RTCNN, which is a neural network score. You can also combine structure-based scoring like this, along with the ligand-based score, or you can build your own scores based on the information provided in the hit list. Once you have your hit list, we also provide tools for filtering that hit list. So you may want to cluster the hit list and select a diverse set of compounds. You may want to run multi-parameter optimization, build an MPO model for blood-brain barrier or drug likeness or something like that. Those tools are there. We've also incorporated MD into ICM, so you could take your hit list and you can refine the top scoring poses and use those and see if there's any drift in the pose, and maybe you want to remove those that drift too much, and we have ways of analyzing it that way. And then you can do things like interaction fingerprints. You can filter your hits based on those ligands that make particular interaction with a particular residue or avoids a certain part of the pockets. That kind of thing can be done. And then ideally you have hits, experimental hits, and you can test them experimentally in the lab. So Ruben touched on many of these things, but just to summarize that, our regular virtual screening we sort of refer to as ICM VLS. It can be run on CPU. It's pretty fast on CPU. You're talking about 1 to 2 chemicals per second per CPU. So you can screen databases of maybe up to 10 million, 20 million, that kind of thing. Relatively easy if you have a decent back-end server. But if you want to explore these very ultra-large databases, we have solutions, one called Ridge, which currently is the fastest docking software on the market, which screens 100 chemicals per second per GPU. There is a GigaScreen, which is a combination of machine learning and Ridge docking, which if you just get a regular gaming GPU box, you could probably screen about 1 billion chemicals per box per day using that approach. And then there's CombiRidge, which Ruben has described. Also, the 2D and 3D ligand-based searching is there. If you just open ICM, you can search the real database by substructure and fingerprint. We provide that database as part of the ICM software. And you can do, we developed this primarily initially for enamine because they had the real database, many billions of compounds, but they didn't have an efficient way of doing substructure or fingerprint searching. You could also do a 3D pharmacophore search. So you could take your 3D chemical and extract explicit pharmacophores in 3D space. So you could say, I want a hydrogen bond donor here, acceptor here, and a ring system here, that kind of thing, and screen against that. Or you can screen against a combination of shape and ride. And with these two approaches, ride and shape, and 3D pharmacophore and shape, you can also include a representation of the binding pocket, like a restricted volume penalty. So when you screen against these fields, it will give you a penalty for hitting the receptor or being in contact with the receptor. So it's a combination of structure and ligand-based is available if you want to try that. So we have a relatively straightforward licensing system. We don't have tokens. So most of our customers, you would buy for virtual screening, for example, you need some way to set up the docking. It can be done completely on the command line if you wanted to, but it's pretty a better practice to carefully analyze the binding pocket, and you can do that in the 3D graphics. And there's a full automation of receptor preparation for you. So those are the front end licenses. It can be run on Windows, Mac, or Linux. And then you would need a back-end cluster license, or if you wanted to do high throughput virtual screening. That can be either CPU or GPU. It can be your in-house server, or you can run these on the cloud. So either AWS or Google or Microsoft Cloud. And then when you have your data, you may want to share that data with the chemists on the bench, or your collaborators or your customers. And so we provide easy way of doing that using completely free software. So if your collaborator, you can share your results. So here's the little hit list from a virtual screen, some clustering, and so this is a plot of clustering here, 3D images, all kind of data, all in one single file, fully interactive. You can also have HTML text, which has hyperlinks. And so your collaborators can just download ICM browser for Windows, Mac, or Linux, or iMolView for if they have an iPad, you can share on an iPad. But one approach we use quite often here with our customers, with our contract research projects, is we use ICM JavaScript to share the docking results. So you can just send your collaborator an HTML link, and they just click on that. They don't need to download any software, and that's a fully interactive environment as well. So those are the licensing options. Just some history. So the first ever successful virtual screen was done by Molsoft. It was in collaboration with a company called ISIS, which is now known as Ionis, based here in San Diego. And interestingly, it wasn't against a protein structure, it was against an RNA structure. And so this is back in 2000, and it's a team of Ruben and others from this company. So the good first test for any virtual screen is, can you take out the ligand and redock it? And they did that. They found that the ligand ranked 17th out of their probably a very large database at the time, which was 153,000 chemicals. So they knew that ICM VLS could filter out like 99.98% of database and still retain active ligands. So with that information in hand, they confidently just tested 8 chemicals and assayed them, and two new HIV-1 TAR inhibitors were identified. As we moved on from a bigger screen, the world's largest virtual screen was undertaken in collaboration with scientists at Novartis, particularly Donovan Chin and Stephen Litzler, and AWS. They managed to complete 10.6 years of drug screening computation in just 9 hours, which led to 3 new lead compounds. And if you go to this on our webpage, ICM Cloud, you can watch a YouTube video where Steve Litzler from Novartis at the time describes how he did this and how he set up the AWS as well. And at this site, there's also a description of another very high throughput screen, which they screened 680 million chemicals in 24 hours, identifying new leads for pain relief, targeting at GPCR. So there's 2 examples there. So just recently, we heard from our collaborators, customers at ChemSpace, some very talented scientists. They competed in the CASH competition, which is run by University of Toronto, Matthew Shapiro's lab, where the CASH challenge focuses on specific protein targets of biological or pharma relevance, and the participants have to predict hits, and then CASH actually validate these hits experimentally. There have actually been 6 challenges so far, but they've only released the results for 2 out of those 6. And excitingly for us, ICM has been used by the top performing teams in challenges 1 and 2. So we're quite excited to see the results of challenge 3 come out. This was challenge 2 by ChemSpace, and they screened 176 billion chemicals using ICM. Initially, they screened the fragments of the X-real space. They scored those fragments, then they enumerated those fragments to the best scoring fragments to the larger library, and then screened that library. It's a pretty challenging target, and this is an initial hit. So these would hopefully be able to be improved in the future. Some other recent virtual screening success stories were reported at our UGM last year here in San Diego by Nadia Tarasova and Mark Nicholas at the National Cancer Institute, the NIH. They reported new inhibitors to very challenging targets such as TIGIT, CD155, TIM3, and KRAS, and some others listed here. This is an interesting paper that describes their identification of inhibitors to STAT3, which is a transcription factor linked to cancer. It's often overactive in cancers, and it's been labeled undruggable target primarily because STAT3 lacks traditional binding pockets, but they were able to use ICM to identify protein-protein interaction sites, which they targeted through virtual screening of their own ultra-large library called SAVI, which is it's based. I think some of the you have to read the paper, but there's some of the SAVI is connected to enamine. I think the enamine make their compounds, but it's a completely unique set of chemicals for virtual screening, and it's one of the databases we have in our chemical space at Molsoft that you can download. Yeah, Ruben also talks about the D3R competition. We talk about it because it's the last one where completely industry wide. One of the reasons why ICM outperformed the other method is that we're able to use not only one crystal structure, we were able to use an ensemble of crystal structures to represent the flexibility of the pocket, and we were able to incorporate atomic property fields. And so the paper by Ruben, Max, and Polo Lam, there's three individual publications from each of the three challenges that they competed in. So the first challenge was to predict the interaction of 36 FXR ligands. And we ranked first, and the challenge 3 was against cathepsin S and some kinases. And the fourth challenge was macrocycles, which are a bit more challenging. But in all three competitions, Molsoft ranked first in terms of RMSD, screening, and also the prediction of binding energy. Mohsin will talk about this, and Ruben also highlighted it. I just wanted to point out the paper is available here, is listed here. And at the end of the paper, there's a very good comparison of just Molsoft versus Glide in a non-covalent screening. So it's worth reading that paper as well. This is completely independent analysis. So once you've done the screening, you need to be able to predict, once you've done the docking, you need to be able to score the docking pose. So we have a well-trained and recognized scoring function, physics-based scoring function, which has been used for many years and is always being updated and continuously improved. So the scoring function has terms for van der Waals interactions, so like attractive and repulsive forces between atoms, electrostatic interactions, Coulombic interactions between charged atoms, modulated by like a distance dependent dielectric, hydrogen bonding, donor acceptor pairs, desolvation, the the energetic cost of removing water molecules from the binding site, and an entropy penalty, typically.
Yeah.
Are you okay? Yeah, I heard a ping.
Yes.
Okay. Yeah. So the other score we have, structure-based score, is the neural networks score, which we call RTCNN. I won't read it all out, but you can see how RTCNN is derived. It's a convolutional neural net using topological convolutions and 3D radial convolutions. It differs from the physics-based score because it does not use any molecular mechanics or physical energy terms. It's trained primarily to distinguish native-like complexes from decoys based on the geometries of complexes from the PDB. So all favorable or unfavorable interactions are learned from the training examples rather than any predefined input terms. One key distinction between the RTCNN score and the regular ICM score is that the score has a lower penalty for minor ligand receptor clashes, which you might see in your scoring. And as with the physics-based score, a lower RTCNN score indicates a better predicted ligand receptor interaction. So, yeah, sorry. So this is actually RTCNN actually performs better than the physics-based score in our benchmarking and also in this CAS 2016 benchmark. And we find from our projects here that generally it's better to combine the VLS score, which is the physics-based score, and the RTCNN score. So once you have your hit list, it might be a good idea to sum those two scores, and it improves the enrichment factor by doing that. Or you can take a selection of the best RTCNN, the best physics-based, and maybe some combo. So it's just a suggestion. So if you want to use the GPU modules, you would be using an NVIDIA a GPU, but we now updated for M4 and ARM. This picture shows a typical box that some of our scientists here use as a desktop. It's like a gaming desktop as an RTX 4090 GPU. If you're in a good situation, you have a data center with GPUs, you can also parallelize all of our GPU-based screening tools that we have. So all of our ultra-large library screening relies on pre-generated conformers. Our regular ICM VLS, the ligand is fully flexible in the pocket. But for GPU docking and screening, you need to generate conformers. And this paper was published by Ruben and Max and Eugene Rausch here at Molsoft, a very recent paper. And it's about Ginger, which stands for Graph Internal Coordinate Neural Network Conformer Generator with Energy Refinement. So it's a cutting-edge tool that uses a state-of-the-art, like, generative neural network-based algorithm. So it efficiently explores the conformational space of the molecules, delivering diverse and low energy conformers. So the key features are really like high quality conformer ensembles. The conformers undergo faster gradient force field energy minimization. And it's also, as I mentioned, GPU accelerated. So we have 10 million compounds can be processed in just a single day using an RTX 4090 workstation. It's extremely efficient. The generative algorithm provides accuracy comparable to our leading rivals with 40% smaller ensembles. And it has a variety of customizable options. So you can change like the density of the conformers that you generate and the size of the number of conformers. One of the other major strength is the scalability. So it handles very large molecular data sets very well. So billions of molecules could be converted. It has very efficient memory and storage optimization as well. So in testing, they found that like 99% of compounds in a typical ultra-large database can be converted, leaving 1% which are missed. But those 1%, we find that they're always in the Ginger method. They're tagged, so you can go back and find the ones that didn't convert, and you can use our CPU conf-gen algorithm to convert the remaining ones if you want to. Ruben showed this slide, but I just wanted to point out that these databases, if you have a GPU license, these databases are available to download. Honestly, this is one that we screen on a regular basis here at Molsoft for our contract research projects, and we get hits. This is a collection that we make here at Molsoft called Molsoft Molcart Compounds. It's about 10 million in size, and it consists of databases from a variety of different vendors. I think about 30 different vendors. It's kept up to date, so these are off-the-shelf compounds. So this is you don't necessarily need to go to the trillions, but they're there if you want. But it's a good way of getting an initial hit, and if you have a hit, or you can then take that hit and go back to these bigger libraries and search for analogs and try and improve the hit. But these are all available to screen if you wanted to. Enamine Real, Wuxi, the SAVI database from NIH, and this new one from eMolecules, which is about 7 trillion. So Ridge. So Ridge is our state-of-the-art docking engine now. It's fully leverages the GPU power of your GPU processor, while also utilizing the CPU resources for like a perfectly balanced computational load. So it's kind of innovative in that respect. You can screen about 100 chemicals per second per GPU. So the docking engine operates in 3 distinct blocks. This central part is the GPU block, which handles the docking, and it's run entirely on the GPU. The first block is a CPU block tasked with sort of managing the database and assigning charges and that kind of thing, preparation of the ligands. And then the final block is the scoring. So you can use RTCLN scoring, which is fast, or you can use the physics-based scoring, which is a little bit slower, but available. So the main thing here is that if you could screen 10 million compounds in 30 hours on that $4,000 desktop computer that I showed earlier, on the 1090 NVIDIA 4090 processor. This graph shows the accuracy compared to, so ICM, the green is ICM doc, which is our regular ICM VLS, and where the ligand is fully flexible. The red is Ridge, which is using pre-generated conformers as a benchmark, showing that you get pretty decent comparability to the fully flexible ICM VLS using Ridge. I just wanted to show this slide just to show, because the next slide and Ginger relies on deep learning. So there are some deep learning tools in ICM that are built on the Apache MXNet deep learning toolkit, which gives you an option to generate extensions to it, which Molsoft has done. And these are Molsoft ICM specific extensions. So Ruben and Max and Eugene have built tools for chemical topological convolution, 3D convolutions and pooling. So these are essentially ways to analyze both the structure and the 3D shape of molecules. There's also operators that they built for chemical graph transformations, which help model the unique connectivity of molecules. And there's special features to handle the complexity of biological data, those that have like most, if you're building training models, not necessarily docking, but you may have to work with MXNet for your training. So you can use regression models, classification approaches, so binary sort of labels and regression. So the models can be trained per atom, per bond, or per molecule data. A model, torsion profile model, and it's published in 2020. And you can use it. It's fully flexible via ICM scripting and it has full GPU acceleration. And the reason I want to show that is because we have a to it. So GigaScreen is like an innovative deep learning framework for screening ultra-large libraries. The protocol combines VLS with machine learning, and it enables efficient and accurate prioritization of compounds. So as with Ridge, for post scoring, you can use RTCNN, or you can use our physics. Sorry, is it okay?
Andy, your internet connection seems to be a bit broken.
So extract.
Yeah, please go ahead. You have another 5 minutes.
Okay. So we have you take a random test set from your ultra large library, you dock it using Ridge, and then it's you have a training iteration here using a GCNN model. You score it, you go back to the conformer database, extract another test set, and you keep repeating. You can then score the final selections using Ridge or ICM VLS, depending on how many hits you have from this. So another option for ultra-large libraries, which is extremely efficient, is CombiRidge. It's benchmarked on the 28 billion enamine real benchmark. It's kind of the Ginger method in situ. So conformer generation is made directly at the binding site. You start with a 3D anchor core fragment, and then Ginger generates the full 3D conformers while keeping the anchor, the good scoring anchor, in place. There's full GPU grid and Cartesian refinement, and all stages are GPU accelerated. It's good for R group screening, covalent docking, and also combinatorial docking of large libraries. Another success story of using screening very large databases was published in Nature by Sevakatris's lab at USC. Using ICM at every single step, they took the fragments from the enamine real database. In 2022, it was 11 billion compounds. Now we can do this with 38 billion. You dock those fragments, you score the fragments, you enumerate the best scoring fragments, then you have a set of compounds that are easily docked using ICM VLS. So all this is done. You don't need GPU. It's an example of using CPUs for ultra-large libraries. The good thing about this approach, it seemed to generate new antagonists and that are significantly different from the published data. So it's finding new chemistry. It's also significantly has a much higher hit rate than a traditional screening. So the hit rate was approximately 33%, and they've published other papers since on similar thing with even better hit rate. Just to finish, the ligand-based approach, the atomic property fields is a 3D pharmacophore which replaces discrete points with continuous property distribution. So the 3D potential reflects preferences at various different points for one or more ligands. So you have you could superimpose. If you don't have a crystal structure and you have good activity data, you could take your best leading compounds, superimpose them, and then screen against the properties of those 3D properties, such as hydrogen bond donors, acceptors, hybridization states, size, lipophilicity, that kind of thing. It's also can be run on GPU or CPU. The enrichment for RIDE versus RIDE uses pre-generated conformers. We also have a method which is flexible APF, similar to the structure-based docking, and the enrichment factors are similar depending on which method you have. But if you're trying to screen the ultra-large libraries, you would need the GPU RIDE version. And just to finish, all these screening methods and modeling methods we've packaged into a product called Molscreen. These are pre-generated high-quality machine learning AI models for a number of different drug targets, as well as ADME-tox targets. So you can download a single model, or you can download a panel of models and screen against those models that are already there. It uses a variety of different approaches, 3D pharmacophore-based, protein structure-based docking, ligand-based, all depending on what kind of information we can use for the modeling. So there's approximately about 3,000 self-contained models, and the models are embedded inside ICM. A selection of free models are embedded inside ICM, mainly the ADME-tox ones, such as HERG, I think, prediction of lethal dose, some absorption permeability models for like KK2 and PAMPA are included. But if you open ICM and go to Molscreen menu, you'll see those there. Also, they're also listed in the chemistry predictive properties. The models differ depending on what information is available. So they can be, these are extremely fast models based on activity prediction trained on the big data using fingerprints. If there's 3D chemical information, you can use that. Some models incorporate both crystal structures, multiple crystal structures shown here, ligand-based data as well, and for prediction of PKD. There are also neural network models for different families. So these are extremely fast. So it's great if you have like a set of chemicals, you can just run it against the kinase family classification models, and you get your results very, very quickly, and it will give you an idea of which other targets your ligands may hit. So finally, I just want to I was just focusing on the virtual screening today, but ICM is a comprehensive drug discovery platform from biology through to chemistry, the cheminformatics side of things. It's cutting edge. It's always continuously being updated. So we welcome your feedback and any comments you may have. Proven success stories are published. You can read those. We have quite a few on our YouTube channel if you want to go through some tutorials. They're there. Next week we have a webinar on ultra-large screening, and it will give you how to do Ridge, how to do GigaScreen, how to generate Ginger. If you have any questions after this, please feel free to email. I'll be happy to answer them. Thank you very much for your time.